We're at Newcastle City Hall today at Health and Homelessness Interagency Forum. We've got the local health district, our acute hospital system, we've got primary healthcare, and we've also got Homes New South Wales and DCJ. It's not often that these three parts of the system come together to talk about how we can work more effectively to ensure that people who experience homelessness or are residing in social housing get access to healthcare in a timely manner and care that's really appropriate for their needs.
Homelessness is a significant issue for our district, and the health outcomes are quite poor. So it is important that the district, in partnership with the PHN and our local stakeholders, have a plan to try and tackle some of these challenging issues. It is only through partnership that we'll be able to achieve some of the outcomes we need.
We need to be looking at people who are homeless and what is their experience, and what does a pathway for them actually look like. Their experience is not going to be the same as yours and mine. We need to understand that and then learn about how we can gently and kindly be in the right place at the right time and build trust with people. And then when they're better, they can navigate the system. But we need to step in at that critical point in time.
Part of our role as a PHN is understanding the needs in communities and then trying to commission services to support those needs, but also coordinate services to address them. In the area of homelessness, it's traditionally been an area that has been seen as particularly a social issue or a justice issue or a housing issue, but increasingly it is also a health issue. It's a public health issue as much as anything. And for us, the need to tackle that in a coordinated way is very important. We know that we can't address that issue ourselves, but if we come together with the right partners, that we can do that in a very effective way, and that's what we're hoping for.
I've been so amazed at the energy in the room today. People really can see how that collaboration can make a real difference for homeless people on the ground, but also what do we need to do differently in government to respond to local needs. And so having that both a local conversation and a strategic conversation about how systems can work better together, it's been very refreshing.
We've been workshopping 8 different ideas that potentially could help solve local problems and to try and get people faster access to the care that they need to either help them maintain their housing or to them to stabilise to move into safe and secure housing.
So we've already heard from the Chief Executive Officers of our PHN, of the Hunter New England Local Health District and from Homes New South Wales. But also in the room we have people from local health and housing providers, primary care providers, specialist homelessness services and some of the local Aboriginal services as well. And so we know that they have all different perspectives, but they also have an absolute willingness to work together.
Really getting into some of the detail about how we can share information, how we can make sure that people who are exiting from health facilities can make sure that they're not exiting into homelessness, or at least getting the kind of support that they need when they do leave health settings. And that's really going to take us all working together.
The biggest positive that I got out of today was to hear health talking about housing and homelessness so much, and especially leaders in health, and that it's actually in their thinking and in their action plans. That is absolutely brilliant. That they were in the room talking to us, that's fantastic.
So today what I witnessed was a great commitment from all organizations to work on some of these plans. Particularly, there were very important and critical ideas presented. We were able to find opportunities which will allow us to make some changes within the system, to work more closely, to solve some of the challenging issues which we have in front of us. This can add to the great benefit in terms of the health outcomes for people with homelessness.
With the right people in the room, I know that we can put together some small local initiatives that will start to make a real difference.